Dear viewers, we have been joined by our second and final guest for this evening, Dr. Abdullah Alkhanfar, family medicine resident. Good evening, doctor. Welcome back to Hala Kuwait.
Good evening. Thank you for having me again. Such a nice seeing you, Rita.
Thank you so much for being here. So today we're going to be talking about healing. And I feel like lately a lot of people are on their very own healing journey. So what is healing and how can we do that?
It's such a trendy word now. Every day is like being used. Everybody is using the word healing.
Yes.
So we can hear sometimes someone saying, I'm healing from certain relationship, or I'm healing from certain household which was toxic, or maybe I'm healing from certain environment I was living on. So we can say that healing is a direction, not a destination. We can say that healing is not just self-improvement. It is recovering our lost parts of ourselves, not just improving them or changing them.
Definitely.
We can say that it is reconnecting with our unique qualities that we were born with. Healing sometimes shine a bright light on our wounds, on our suffering, on how these wounds affect us and those around us. So some might say that healing binds two aspects, which is the mind and the heart, which lead us to something very big, which is truth. So healing journey by itself leads us to something very big, which is how to be authentic, how to be truthful while living, especially in medical settings, especially in clinics. So we can say that healings let us face our darkest moments, our darkest sides. It can lead us to dealing with shameful emotions, such as guilt as well. So healing is a very big term. It has a broad aspects. It has different type of meanings. But today we'll try to simplify it and have to discuss it in a very simpler ways.
Definitely. And I think healing is a journey, does not happen overnight. But I think that's why a lot of people need to understand the principles behind how we can navigate healing and our journey. So can you tell me about the principles that we can use for ourselves when it comes to our own healing journey?
Sure. So we might say, importantly, just mentioning that healing does not have a specific road.
Yes.
Healing always finds you. So there are certain principles that we can discuss. Most of the important ones. First, we can talk about something called authenticity.
Right.
So authenticity is something like lived, experienced, comes from a place that you love yourself. You want to accept yourself fully. You want to accept your darkest moments. You want to accept your shadow, your darkest traits.
Yes.
Being authentic means that you might disappoint someone, that someone might dislike you.
That's
but rather you will always feel like authentic within yourself. You don't need to be liked by your environment, or you don't need 24/7, I mean.
Definitely.
You don't need to have everybody approving of your points or your thoughts or the way of thinking. Lack of authenticity sometimes shows itself in medical clinics as anxiety, depression, or as well as being like in a very fragile moment.
Definitely.
Yeah. So this is one of the, let's say, aspects of principle of healing, which is being authentic. We can ask some certain questions when it comes to authenticity. Am I sacrificing myself so that everybody can accept me? Sorry. Am I just showing my fake side so that the environment or the society can accept who I am? So these type of questions, these type of practices help the patients or help individuals into practice authenticity, into getting in tune with their authentic self rather than just put a fake persona when it comes to dealing with the society.
Definitely.
Second principle we can say is agency, which is taking yourself accountable for your actions, taking responsibility of your whole existence. Any lack of agency is a source of stress. Lack of agency sometimes has different types of reasons. Maybe it's poverty, maybe it's injustice, maybe it's past trauma that happened through your life. So taking let's say the time to be accountable for your actions, to be responsible, is some sort of a healing aspect.
Yes.
It has a huge aspect when it comes to your healing journey. So having the bravery to take to take agency, to be responsible, is another principle when it comes to your healing journey. We can speak as well as the third principle, which is anger. And it is a very important emotion.
Definitely, and it's a big part of healing, to be honest.
Yeah, so the type of anger we're speaking about today is the healthy form. So I'm not talking about raging, resentment, or just spreading venom. I'm talking about how to set boundaries with your community, how to learn how to say no to certain aspects, learn how to say no to certain relationships. So the healthy anger we're talking about is that anger that is situational, that has a short period of time, that comes for a certain task and it will leave you. It will not be suppressed, or it will not be bottled up inside of you. All of these emotions, such as anger, grief, when it's bottled up, it will lead us to a very specific diseases. Most of common are the autoimmune diseases, or depression, or anxiety as well.
Definitely.
And the fourth principle we can say is acceptance. So acceptance is a very also like a big term when we say acceptance, where what are we accepting exactly? It is basically allowing things to happen as they are. Let it be. By accepting, you're able to process your emotions, not just clutch to your past, not just clutch to the pain that you went through or your stressful, let's say, situations that you've been through. So when I say acceptance as a principle of healing, I mean like letting things flow, not just be strangled in such time or such trauma that you went through and let you stop in a certain let's say a specific timing that you couldn't move forward. There is always more. There is always time or place for improvement or getting better. So acceptance is a form of you accepting your authentic self, processing your emotions, having the audacity to be responsible for your actions, for your emotions as well.
For sure, and I personally think that acceptance could be the hardest part of healing. For sure, it's not the easiest thing to do.
Even accepting that it was hard is some sort of, let's say, a principle of healing. Like what I went through was so hard, it was so traumatic. Accepting that term itself or accepting that type of thinking will help you move on, that's for sure. Any confusion, any resentment, any anger, all of these are indication of acceptance. We're not just sad because we're sad. No, this is an indication that maybe you were wrong and now you're trying to correct things.
For sure. It's definitely a step in the right direction and we are going in the right way. So how can we actually incorporate compassion in our healing journey, and what's the thing between compassion and healing? What's there? So
what's the correlation when we say compassion? You know that a lot of people, when they deal with trauma, when they deal with their healing, there is a lot of hurt. There is a lot of pain that will emerge. So when we say compassion, we are literally learning something new, which is accepting pain as it is. Pain is not your enemy. When I say you need to be compassionate, I am just teaching you a new principle of learning how to deal with pain. So pain is not your enemy. You don't need to protect yourself from pain. Rather, you need to know how to deal with it compassionately. Compassion leads you, let's say, it opens a new door to deal with your trauma, with your wounds, in a compassionate way rather than judgment, rather than self-rejection or self-hatred. A lot of people go through horrendous, let's say, situations or traumatic situations where they feel ashamed, where they feel a huge amount of guilt. We come to them as doctors, not just prescribing medications. I can come to them and be empathetic and be compassionate with that journey. You had to go through what you've been so that you understand, evolve, and have a new perspective and thinking when it comes to dealing with life itself, whether it's problematic, whether it was a stressful journey. This compassion, what we're speaking about, is giving you the new principle of learning that situations, diseases, conditions is a way of teaching. You will learn new aspects. You will learn that underneath you there is more, there is depth beside that personality that you try to show to your community.
Of course.
So compassion is like digging deep into the person's psyche, telling him that there is more than just your struggles. There is more than just your exteriors. There is always more inside you that needs to be shed light on so that you can flourish. You know?
Of course.
And that happens through various of events. We can say that firstly you can accept pain as it is. Don't fantasize about changing the experiences that you went through. Just try to hold them, try to accept them as they are. You know, that's some sort of compassion that we speak about. It also leads us to a very important aspect, which is learning how to deal with community. Like if you're always, let's say, unempathetic, always having these resentments toward your traumatic events, you will not be able to be connected to the present moment. So compassion helps you connect with the present moment, connect with your community, try establish a new form of environment, which is a healthy environment, and that's what we aspire for.
Definitely, and I think if we're not living in our present, we're going to have more traumas.
We are, especially in these times and in these hours, yeah.
So compassion is a really important part of healing, I'm understanding.
It's like a door we keep open for opportunities to explore more when it comes to psyche, to explore more when it comes to situations in life.
Yes.
So there is like a compassion of possibility. There is always more to life. Yes, you went through a hardship. Yes, you went through a traumatic event, but that does not justify it. That does not identify with you. There is more to your trauma or what you've been through.
Definitely. Yeah. Dr. Abdullah, the thing is that 90% of the patients that we do meet usually do not want to take medication.
True.
When it comes to healing, their mental problems, or anything they're feeling emotionally.
True.
What are the steps we can use to actually heal without actually having to go out and be
just
on
take
meds?
medications?
Exactly.
So I'm not just going to say like medications are not helpful. Of course, they have a major factor when it comes to treating various conditions. But what we see in clinics is that these patients came to us in the later stages with their undiagnosed conditions. So my main concern with any patient that comes to my clinic, why are you here today?
Yes.
What brought you to me? So there is a story. There is a timeline that led to this condition. So what might help rather than just medication is understanding that beneath your personality traits, beneath your persona, there is depth. There is more to you. So most of the steps that we can say is humility. What do I mean by humility is that no one comes to this world with a manual. You didn't know the answers for everything.
We did not.
And we didn't either know the questions for these answers as well. So to have this type of a mindset, to have this type of practice helps you not stress when it comes to not knowing answers. Let's say you are in a stressful situation and you don't know the answer of this stressful situation. That's okay. Just live it, sit with it, explore it, have some sort of, let's say, generosity.
Just take time to maybe absorb it all and be able to feel it, process it for sure.
Like the first step when it comes to stressful events is to sit with it, apply some generous curiosity, not just panic. Not just like scream, cry, and of course that's part of healing, by the way. But like sit with the emotions, sit with the stressful events, try to understand why am I going through this, what am I trying to learn? What aspects in life that needs to be evolved.
That's right.
So that's what we call humility. The second one is generosity. What do I mean by generosity is have the time, have the space to explore yourself. Why am I going through these type of events? Maybe it's a cycle. Let's say it's a cycle of a toxic relationship or it's a cycle of a toxic environment. Why are you being put in such environment? What aspects of yourself that you need to improve? All of let's say maybe you are in a stressful situation because you're a nice person, and we see this a lot in the clinics.
So much.
So the nice person always wants to maintain the peace between relationships, does not want to burn bridges. What studies have shown that these nice persons and these hyper-responsible persons later on develop autoimmune diseases because all of these suppressed emotions, all of these you being fake nice just to maintain this relationship. So learn how to say no. Learn how to set boundaries when it comes to your relationships. No, don't just be generous when it comes to your time with people. So learning these, let's say, simple aspects will for sure help you go through life, go through traumatic events without getting stuck, without getting traumatized. Because the trauma is a part of our life, whether we like it or not nowadays.
It's definitely part of our lives, and we all have our own traumas and trying to heal them constantly, especially with the help of doctors. Dr. Abdullah, thank you so much for being with us this evening.
Thank you for having me. It was such a pleasure. Thanks.
Dear viewers, we had with us Dr. Abdullah Alkhanfar, family medicine resident, and up next we have a report.